Today class, in this video we are going to introduce the erectile dysfunction and premature ejaculation. These two diseases we are not going to discuss in details. The reason is because the etiology and the pathogenesis, as well as the management and also the advice to the patient, are very similar to the nocturnal emission. So for the etiology, the definition, and the causes, we just go through the notes as well as the previous video for the nocturnal emission. They are quite similar. The symptoms you're going to go through by yourself, and as well as the points, also quite similar. The only thing that I want to emphasize in this disease is especially for ED, the erectile dysfunction, the emotion contributes a lot. So the patient, you need to advise the patient to relax, especially the anxiety, the stress will contribute a lot. So in very common situation, the patient is in fear of the ED and it results in ED. So that's the psychologically you need to assist the patient to relax. And also in the treatments, although we emphasize the kidney, we always emphasize the kidney, but for erectile dysfunction, premature ejection, we also need to emphasize on the liver. The liver stagnation will contribute to ED and premature ejaculation. So the treatments, you also can focus on the liver, especially nowadays because of the stress. The stress from your work, from your study, or from your daily life, the stress will result in liver stagnation, and liver stagnation also can contribute to the kidney problem, results in either ED or premature ejaculation. Apart from the treatment of the liver, kidney, for ED, so it's not this slides, the previous slides, for ED, based on your treatments, based on your syndrome differentiation, you also can add 1 or 2 points to activate the blood circulation. It also can benefit the treatment. So blood stasis. As you can see now, the qi stagnation that we said from the liver, the qi stagnation may result in blood stasis. But from the physiology, that's from the conventional medicine, the physiology or pathology. That's also from conventional medicine. Also from conventional medicine point of view, from the pathology, the ED is also due to the lack of blood supply. So the activate the blood circulation. That's also very important. But from our theory, the qi deficiency or qi stagnation also may result in blood stasis. That's why you can use blood 17. Activate the blood circulation. So that's something you need to consider during your treatment. You see, this group of treatments, these 3 males problem, mostly we're going to focus on the kidney, the liver, and sometimes the heart and the spleen. But the emotion also contributes a lot. So you need to advise the patient to relax, don't stress too much. The more they stress, the easier this problem will happen. So one is psychologically, one is psychologically, from emotion, you need to assist the patient. And then our treatments, we will focus on the liver, the kidney, the qi stagnation, the blood stasis, as well as sometimes the heart. So whenever you see this type of diseases, you can think from these aspects. Thank you for your attention.